So Mercy, tell me a little bit about I'm really interested in your work in Uganda, historically, and then how you came to work in AMR.
Okay, thank you so much, Tasha, for that question. That is a very important question. So my name is Mercy, and I have been working in patient engaging activities for the last 9 years, and through the greater involvement of people living with HIV, an advocacy program. And this program started very many years ago, about 2005. And this work has really been mainly centered on HIV advocacy, health literacy and promotion, both at health facilities, specifically at the Infectious Diseases Institute HIV clinic, but also in the communities around. So this specific advocacy program has two components. It has the music, dance, and drama component, where we use music, dance, drama, and by that I mean we bring out the different health messages through the different dancing, music, and acting techniques to reach out to a number of communities in Uganda, because we believe most of our Ugandan communities, using their traditions and cultures, they will best understand this language, because also because of the kind of illiteracy rates that are in the country. Not everyone is really educated and also factoring in the other populations, that like the people living with the disabilities, especially the blind who may not be able to read the posters, or the deaf who may not be able to hear what maybe somebody is educating. So we try as much as possible to incorporate different techniques that these people will be able to relate with, but also get the message. Yeah.
I think it's really interesting, this question, this idea or notion around using the arts to engage people. So from my perspective, our work in Cape Town is using documentary film and photography to engage young people. And we combine that with engagement with research, biomedical research, rather than health information, because actually in South Africa there's a lot of groups, especially around TB and HIV, that do a lot of health information. And we thought, because I'm trained as a scientist, a molecular biologist, we thought we had an opportunity to do research with engagement with biomedical research. And then you've got on the one side all this knowledge about research and the causes of disease and what are we doing to find better solutions. And then with the documentary film, there's all this community-based knowledge. So, like, how does disease impact people's lives? What lived experience do they have? Mercy, I'm also quite interested in. I think we often talk about the things that have gone well, but we don't talk about the challenges. And I'm interested in what are the challenges around engaging people in Uganda around AMR.
Okay, thank you so much. That is a very good question. So picking from examples of some of the experiences we have had, especially at the point when we're educating, the biggest challenge is really illiteracy. Even when we try to package this information, there will still be those that will not still get the message. Or also sometimes the system, the message is still new, if I can use that language. The message, especially around AMR, is still new. We'll still have this population, even when you educate, they'll still come out and ask, what is an antibiotic? Then you have to find a way how to package what an antibiotic really means. Then you have to break it down and say an antibiotic is a drug that prevents you from getting a bacterial disease. Then a person will also ask you, what is a bacterial disease, if you know what I mean. Then you'll have to find simpler, you go back to the basics of science, yeah? Back then, a bacteria is a germ that causes da-da-da-da-da. So you have to find, so it's really about, the challenges are really around the education, the illiteracy rates for majority of the population, but also going back to the culture. We are also coming to an environment where people are used to a certain way of doing things. For example, when I fall sick, I don't need to ask a doctor. I just go straight to a drug shop, yeah? And even the person at the drug shop may not care to say, did you get a prescription? Because it is just a money-making business sometimes. They would just pick my money and give me what I want, but they would not want to care and ask, did you get a prescription? Why didn't you? So there is a lot of need to do. There is a lot of we need to do a lot of, especially on the side of the policies, there is need to enforce some of these rules and say, for example, for ABCD drugs, you don't need to go to a pharmacy, you need to first get a prescription. There has to be a lot of regulation, for example. And also, there has to be, we need to do a lot of education, of course. And so basically, it's just that the awareness that is not there, the awareness, yeah, so there's that gap. So, so you mentioned that you engage young people into young people. What kind of age bracket are you looking at, and how do you engage these young people in what you do?
So we mainly work with high school learners, so adolescents. So between 14 and 18. Depending, usually not 18, so between 14 and 17. And the first part of our flagship program is to take the learners to the lab, and we do experiments in the lab, and we teach learners what research is. We have a workshop on what is a hypothesis, how is research done, and that includes hands-on time in the lab, and then talking from experts. And then we do TB drug discovery, TB clinical trials, and TB transmission, so quite focused on TB. And then we teach the learners how to make films, documentary films. So they get cameras and they learn, they do everything from the learners do everything from the beginning of the process, from the idea for the film, all the way until filming. And a filmmaker will know you can film a lot, but it's actually in what we call editing, the documentary, that the story really develops, that how you put all those shots that you've got together. And so that's like an 8-week program, and the learners come after school. But if your question is, how do we make sure that the learners take the knowledge up? We try to make it as fun as possible. So we don't want the learners to feel that it's another school thing. We try to be very flexible, so understanding that the learners are kids, you know, they're adolescents, so you have to keep them energized, and we have good food, so the learners keep you don't think that that's important, but catering and this kind of thing is very important. They're kids, you know. But the other thing, as I was saying on the panel, I feel that the learners that we work with are really engaged, and the learners want to be part of contributing to solutions for the community that they live in. So they want to learn new skills. They want to tell people stories. They want to learn about science so that they can tell their peers about what they're learning. So even though we work quite hard to make it fun and engaging, so sometimes you'll hear in our people shouting and talking, and that's the energy that we want to have. It's also, I think, the learners themselves are really dedicated and want to be involved. And then the other things that we do, we have a youth program. So once a month we have workshops on a different topic. So we quite focused on TB, and we're moving into the AMR space now. It's very new. But we realize it's not just about TB, so we have HIV workshops, cancer, diabetes, AMR. We're going to have one on HPV, and just last weekend we had one on climate change and health, which was very good. Yeah, challenges.
What are some of the challenges, especially coming from an angle of you working closely with the young adults who, in most cases, are termed as complicated? It's a complicated group of people to work with. And what's the criteria like? Do you just go to schools and say, we want ABCD young people to participate? What is the criteria?
So we work
engaging them like?
We work. So the first question,
yes,
is the challenges are the place that we work in is, so South Africa is a very unequal society. You get like super rich people, and you get people that really don't have much.
Yeah.
And where we work is a place called Khayelitsha, and it's a place that's underserved. So people really don't have access to basic services. A lot of people don't have jobs. A lot of people, and that is very challenging because you're not walking into a school that's well resourced and trying to work with people. You're working with people. You know, I've had learners come to our program and they can't go to school because they can't buy school shoes, and the school's like, you can't come back if you don't have school shoes, and that that's challenging because it's an additional dynamic for the learners. They're worried they may not have enough food to eat at home. And then we don't work directly with schools, so we work with another NGO. So that's the other thing that we've tried to do, like that I really think is important, is to develop networks with other NGOs working in the area. So all our learners are part of an organization called Ikamva Youth, and what this organization does is they provide after school tutoring to learners. So those learners that are already part of the tutoring groups, we recruit into our program as well. So there's that group does the relationship management with the schools. And so networking and building relationships with other organizations that might not be focused on health, but are doing work in the township of Khayelitsha is really important for us to build that capacity and relationships and things like that.
Okay. So I think also maybe to add on some of the work that we have been doing, initially it has been really addressing HIV, TB and all these other health-related issues like cervical cancer screening. So really building awareness about some of these health issues, because the key message is we want to empower these communities. We also want to engage them, to help them be part of what we already know as persons living with HIV, these advocates people. So in terms of AMR, I think for us we have come a very long journey, way before even CAMO-Net came on ground. So what we used to do initially was we used to work closely with our health, with the clinicians to just give the health education. So what usually happens, especially during the AMR week, we have been working with clinicians where we send out messages, we give health education, we participate in art, draw some of this information and put them up on the different notice boards. But also we're still using music, dance and drama. We have acted out, we come up with a script of this is the message we want, let's say based on a theme for this year's theme on AMR, and then we act out a message in relation to that. So all this work really that we have been doing and that we are still doing, because now that AMR is becoming a real issue out there, especially in my country, we are looking at prioritizing it in a way of sending out those messages. But also we have also seen through our work also clinicians being also in a way engaged and also empowered, especially to participate, because we don't want it to be only the patient's role, but also we have seen the clinicians coming out, we've seen the policymakers coming out by just looking at some of our work that we have done. So I don't know how your work is really relating to especially some of the discussion, and I'm glad that most of the discussions were really about public engagement. I usually like to joke around with some of the lead heads of, let's say, nurses or doctors and pharmacists, especially the pharmacy bit. I usually like to joke about with them around things like, at what point do we host the communities in these conference rooms? Usually, and I like the fact that this specific UNGA side event was really thinking about what happens in the community. And for me, the lessons that I'm going to take back is that we need to strengthen some of these activities and see if we've not been doing better. This is the time now to think about more approaches on how we can strengthen community engagements on AMR specifically. So I don't know how you guys are planning to do it.
So that's really interesting. So I think it's absolutely fantastic that there's an UNGA side event.
Yeah.
As you said, specifically focused on how we engage the public, how we engage citizens. What's really interesting to me, and some of the panel members spoke about this, is that AMR is having a moment, and how do we take that forward and continue the momentum? And I think there's opportunity to learn from other health challenges. So how did so much advocacy for HIV develop? There is advocacy for TB as well, maybe not as strong as HIV. So what lessons can we learn from those diseases? I do believe that all of that needs to be resourced, and we need to develop expertise around that.
True.
And I think for our specific work, we try to be as responsive as possible. So we don't have always, we do have a high level, say 5-year plan. But for me, it's really interesting to see what comes from, what reflections do we get from the people we're working with. So as I said in the panel, when we did our first workshop on AMR, we realized that no one had heard of AMR. So it's not like TB, where if you go and talk to the people that we work with about TB, everyone's heard of TB. So AMR, only 5% of people had heard of it. So before we can go and say there's a problem with something called AMR, we have to explain what it is first. So that's, I think, where we'll start with our work and really try and inform people. And then once we've done that, we will look to understanding what do people think about it, what solutions would be relevant in their lives, and how do we create that crosstalk between community and research, and making sure that the research is relevant and that the community supports the research. So that's where we're thinking of going. I think the other thing that's really interesting is how we look at people's environmental conditions and living conditions and AMR. Because there's a lot of work around, and again, I'm new, but a lot of work around WASH. And I think with climate change, there's going to be a real impact on people's environments and living conditions. And I wonder if that isn't a way to create some momentum behind AMR, because climate change feels very real at the moment. And then the third thing, I think it's really interesting to think about how we use MDR and XDR TB to engage people around AMR, because specifically in Kailicha, where I work, I don't know about other places in the world, but everyone in Kailicha will have heard of MDR TB. So how do we explain to people that there's MDR TB, but then there are these other infections where the same thing can happen, and get people interested in it, and that's where. But I think it's been really amazing to have citizen engagement positioned at this level at an UNGA side event, and looking at how we can collaborate, learn from best practices. That's been really, really cool and very positive.
That sounds so great. And I think for me, the one lesson that I actually picked from Mark's presentation on data and polling, for me, I feel we still need to document some of the qualitative experiences of, especially, for example, after presenting in the drama, in the video that you watched, when the drama group leader was explaining that scenario of one of the patients who broke down because they had lost their mother. So how do we document some of those experiences to also use them as a way of creating awareness and sensitizing? I think it's very important that has to be clearly documented So documenting some of those experiences and collecting more of qualitative feedback from some of this work that we would have done would be would be a very great great presentation, maybe in our forthcoming presentations on AMR.